Hi, my name is Heidi Dreyer. I am a second-year medical student at the Idaho College of Osteopathic Medicine, and you are listening to Do or Do Not. Today I'm excited to be interviewing Dr. Rodney Bates, who serves as a professor and chair of primary care at ICOM. Dr. Bates is a favorite of almost every student at ICOM because of his patience and clinical pearls. Dr. Bates has over 12 years of extensive experience as an internal medicine doc, working both in large practice and as a hospitalist before joining the school's faculty. Dr. Bates will describe what it is like to be raised in a rural area and how his interests in medicine and osteopathy were sparked by his interactions with a small town physician. We will follow the professor's journey from college in Idaho to a residency in Michigan and how he made the decision full circle to come back to Idaho to help the new osteopathic school achieve its mission of training the next generations of physicians in a truly underserved physician shortage area. Dr. Bates, thank you so much for being on the podcast today. We're really happy to have you.
My pleasure. It's great to be here with you.
So for our first question, I just want you to tell me about your position, what hats you wear throughout the day, and what your normal day looks like starting when you get up in the morning.
Wonderful. So I wear a lot of hats, actually. I am the primary care chair here at Idaho College of Osteopathic Medicine, or ICOM. I'm also an internal medicine trained hospitalist. I also am a fellow of the American College of Osteopathic Internists and take an active part in national meetings as well as everything here at ICOM. So I am considered full-time at ICOM, and then I do take part in part-time employment through St. Luke's Medical Center in Nampa, Idaho, which is just west of us here at our ICOM facility in Meridian, Idaho. And so I do still take care of many patients, including COVID patients in this difficult time.
Perfect. It sounds like you have very different days depending on what you're doing that day. For a typical day at ICOM, what would your day look like?
Yeah, so my typical day, I come in, usually have 1,000 emails. No, a little less than 1,000 emails to review. Obviously do some supervision of other clinical faculty here as well, and take part in many lectures as well in our systems block courses. So I may be recording a lecture, I may be working on assessment questions for the students. I'm also a course director for our clinical skills small group study for our first year students here at ICOM, and get to be involved in everything as far as training how to write SOAP notes, how to take a good history, really the humanistic components related to standardized patient activities, and help direct some of those activities, as well as come up with cases that the students can work with in the simulation department.
Perfect. So to date, most of the physicians we have interviewed for the podcast grew up in big cities like New York. Your childhood was very different. Can you talk about your childhood living in a small city?
Oh, you betcha. Yeah, very, very different background, I think, as far as that goes, although I've been in big cities. But so my childhood, I was born and raised in a rural Idaho town called Murtaugh, which is extremely small. I think in the town proper, there may be 550 people. That's 550. And so I grew up in a very small grade school. I was in a class of about 19 students, which was considered a very large class for our school. We graduated with 19. The class prior to my year had 7 in their class, and we did have a full functioning high school. And it was great. You knew everyone, may be related to much of the town as well.
Right.
And so it was an experience growing up in a small town. Yes, limited opportunities, limited science training. So becoming a physician was a challenge, to say the least. It wasn't something that I considered possible. And in fact, very rural family would often look at that as being outside of our usual abilities. And so I did have the opportunity to work at a very young age, extremely hard work on a farm. I was employed by a farmer. My family was not a farming family, but some of my extended relatives were. So I was employed at the age of 13. And, here in Idaho at the time, we could drive trucks and take part in full equipment and irrigation duties. And so I had a lot of work responsibilities put on me at a young age, which I think helped prepare me for really applying that hard work and skill in medical school. And so after finishing high school, it was time to move on and leave the town, seek out a career and college opportunities. And so that's what I did.
That's honestly an amazing childhood. My dad is a farmer, and so is my grandpa, and so was my great-grandpa. And when I told them I wanted to go to medical school, I got the oddest looks from everybody. They were like, "You're from the smallest town. We barely even have doctors here." Did you also experience that when you had decided you wanted to go into medicine? Like all the strange attitudes from people?
Absolutely, and really extended family members as well as my own, really looking at it as, think you're better than all of us. This is not something we do as a family. And so, yes, I was a first generation, really college graduate as well. This was not something that was considered something that we do as a family in general, or let alone someone from Murtaugh. There's many successful people from Murtaugh. I shouldn't say that. But yeah, certainly was a challenge as far as someone that could mentor or support me through that decision was lacking.
Right. So did you have any mentors? I mean, was there even a clinic at that time in your town?
No. So we actually had to travel. It was a good 20, 25 miles for any semblance of a clinic. And my youngest memories of that was really with my pediatrician that my mother would take me to in Twin Falls, Idaho, which is about 20, 25 miles away from our home in Murtaugh. And I was always entranced by the physician. And back then it was an interesting view of the physician. He wasn't warm and fuzzy. He didn't have a lot of humanistic components, but I was just mesmerized that he could put together these scientific statements through a little recording device that he used in seemingly mumbling words that I couldn't understand as a young person. And those are some of the earliest memories I had of really being exposed to medicine. I remember feeling I was always entranced by how that physician was able to conduct himself.
Right. So definitely more of that paternalistic influence back when you were going to the pediatrician.
Absolutely. And my father had actually died just before I was born. So my mother raised me until I was about 4, and then she remarried a man who had 4 children of his own. I was the 5th, so we had 9. They joined the family, much like a Brady Bunch, if the listeners are familiar with the Brady Bunch. So yeah, a unique childhood, and then they had one child together, so one that was younger than myself.
So topping it off at 10?
Yes. So it was an interesting challenge. Definitely bringing 2 established families together was a challenge, but they made it through. Hats off to my parents. They made it work.
Yeah, absolutely. So do you think it was that doctor and your experience with that doctor that made you interested in medicine, or was there another something that influenced you going into medicine?
Great question. And, I think he certainly had an influence. This pediatrician did, absolutely. Again, like I said, I was entranced by how he was able to evaluate me and speak into his little device. And then I had a grandmother that was very influential. I recall as a very young person sitting on her lap, and she would look at my hands, and she would make the statement a few times that, "Oh, you have doctor's hands," and that stuck with me for whatever reason. And she put in me a desire to, seek after something that I guess I didn't really believe I had in myself. And, I remember that entranced feeling with the pediatrician that I used to go to, and realizing that, this might be something I would want to do. But it just never seemed like a reality. I never had good science background in my small school. Chemistry was hardly anything. I barely saw the periodic table of elements, and really even how to understand it was foreign to me. So that was a challenge. When I graduated high school, going into going into college. I did well in high school.
Yeah, I imagine that had to have been hard, not being able to see or do a lot of science and then going into such a science intensive field. So where did you go to undergrad, and how do you think you were prepared from high school to go into undergrad?
I think well enough that I could figure it out. And so I went to undergraduate college. I went to a junior college at first called Rick's College at the time. That was a small, well, actually very large. It was one of the largest junior colleges in the U.S., right in Rexburg, Idaho. And I attended there for a year and then served a mission for my church, 2-year mission in Tucson, Arizona, and New Mexico, portions of El Paso, Texas. And on return, that helped me to really grow and develop as a person, really seeing a full spectrum of society that I had not where I grew up. And it was an experience that I cherished, absolutely. Opened my eyes to many opportunities. I had a lot of opportunities to serve in soup kitchens, clothing drive areas, and things like that, just really serving the community. And so that was a cherished experience that kind of put me off on a foot that I could grow and develop and be able to see, now I know I want to be in a service industry of some kind. And so coming back from my mission, I actually applied for and was accepted at Brigham Young University in Provo, Utah, and attended there for 4 years. I entered as a business management degree major with an emphasis in information systems management. And I completed that degree while taking some pre-med courses. Now, I have to mention, I'd met my wife before attending Brigham Young University, so shortly after my mission, we were married, and her father was actually a pathologist in Twin Falls, Idaho. And so getting to know him and asking him more about medicine in general, he was a graduate of George Washington University, very well-established pathologist in the area, and directed the pathology department. And at the time, it was easier for a pre-medical student to obtain some exposures to medical fields. I got to sit in on an autopsy. Was my first real medical experience as a pre-med student. So I got to sit in on an autopsy, a couple different autopsies with him. About passed out the first time, of course, and was able to get back on my feet after that. And just really, he would have me look at slides with him with the microscope. And it was just intriguing and really helped me to, I guess, solidify my desire to become a physician. And so business was more of a integrative decision that I knew I was probably more geared towards business based on my lack of science. But, science was still a very large interest of what I did. And I was able to marry the two well throughout my studies and really be able to accomplish what I needed to well enough to be able to get accepted into medical school.
Yeah, absolutely. That's really cool that he would let you come in and do things, and I'm sure you had a lot of opportunity with that.
Yes, yeah, it was a unique experience back then.
Was he a DO? I'm guessing he was an MD. Did you have any experiences into osteopathic medicine?
I had no idea about the osteopathic profession back then, and he did. I think he at one point had mentioned to me, he said, just don't be an osteopath. They're strange, was sort of his words. He was not a supporter of osteopathic medicine, which is interesting. So I was exposed to osteopathic medicine, or the philosophy of osteopathic medicine, while attending my undergraduate studies at Brigham Young University. Our pre-medical advisor was actually an MD. I remember him being a very staunch MD it seemed like his job was to weed out pre-medical students and really weed those out that weren't solid in their desire to succeed in becoming a physician. So that was a challenge. It was actually a special course that I had to apply to get into where we were able to do some rotations with physicians in the community and come together as a small group with our pre-medical advisor and put together reports of our experience. And through that experience, I really got to know him on a personal level, this pre-medical advisor. And we were driving to explore one of a huge welfare square activity where many medical supplies were being sent out to third world countries and training those areas, and just touring this facility with him. We really hit it off together. And he opened up to me and he said, Rod, I just returned from a trip to Kirksville, Missouri. He said it was my first experience at an osteopathic school, and wow, I was really impressed. And as he talked to me about that, I was very intrigued and said, boy, I know nothing about osteopathic medicine. Let me look into it. When we returned from this trip, I got back to the library at BYU campus and looked up A.T. Still, the founder of osteopathic medicine, pulled his autobiography off of the shelf and read it. And it was life-changing for me. I realized, this matches me as a person. This philosophy matches my goals and desires in life, what I really want to do and what I want to accomplish. And it was all osteopathic medicine from then on out for me.
That's awesome. That's a really cool story, too.
Well, thank you.
So you ended up going to Kirksville, correct?
I did. I was accepted at Kirksville. I was put on a waiting list for Arizona College of Osteopathic Medicine, that at the time was a fairly new school. I would have been entering the second year class after their inaugural class. And that was an interesting experience. I did end up getting an invite to come there about 2 weeks into my classes at Kirksville. And of course, I was very happy to be at Kirksville, the founding school of osteopathic medicine. So yeah, I turned down that option to go to Arizona. But again, it would have been, a little closer to home. I enjoyed Arizona. I served my mission there. But the historical aspect of Kirksville was just intriguing. They treated my wife very well. I had 2 children by this time, and starting medical school, 2 young children, and they were, they catered to my wife and her needs. So we just really enjoyed being there. I think it was a perfect fit for us.
Yeah, that's amazing. And it's kind of like considered the mecca of osteopathy. Do you remember doing your interview there?
I do, very much so.
What was that like?
Giving the background, I probably was not the strongest candidate by any means in science field. I did not have any research experience, primary research. I was not involved in any studies, had not published anything at the time. And so I knew that I may not be the best candidate, but I had a huge humanistic domain experience that I could share. And I recall one of the interviewers had just completed a bypass surgery on himself. He had heart disease, and he had come close to actually end of life for him through this experience. And he basically became very emotional in our interview, and I can surmise, I don't have access to the records from Kirksville on whether or not I was accepted for that reason, but it's one of those tender experiences that we shared a lot of humanistic components of the interview, and I think he may have been impressed by that. I don't know. So I was accepted, and but that experience does stand out. I did interview with one of the science faculty there, and yeah, I got the usual science questions that I thought I might. And I think I answered them okay. I just don't know, but the real connection came from this faculty member. He was actually one of the administrators at the time that had a near-death experience, and we were able to share really touching experiences together, and that was neat, memorable experience.
That's an amazing story, too. Usually it's the interviewee that gets emotional. So do you think that OMM at Kirksville is special?
I would say so. I didn't know that at the time. I kind of supposed it may be. We had very big names there. William Kuchera, who was one of the founding authors of the medical texts for osteopathic medicine, Foundations of Osteopathic Medicine, and his team of osteopathic physicians were considered top of their game. But the thing I didn't realize at the time was how difficult it was to put together all of the techniques and examination techniques that we were exposed to at the time. I didn't realize that was unique until later, when speaking with other students and colleagues after my first 2 years experience at Kirksville. I didn't realize how unique that was when, meeting with them. They had all had similar experiences at their COM schools where they'd learned certain techniques that they could share. And I said, oh, I don't understand that technique. These are the 3 or 4 that I learned. And they said, what are you talking about? There's only one for this. And they said, no, we learned about 3 or 4 for that specific indication. The downside of that, I think, was really taking the osteopathic exam, because, the exams are written by multiple faculty, not just the ones at Kirksville. And so we may have had a little disadvantage in trying to apply that knowledge that we had on a broad base to a specific questions. But I cherish that experience. It's something that I still use in my diagnostic skills as an internal medicine, maybe not so much any manipulative aspects of my training, but certainly hands-on diagnosis and just the ability to really connect with the patient the way that you can with that osteopathic philosophy.
Yeah, absolutely. So you do think, from your experience at different medical schools today, do you think that Kirksville is still the lovers of osteopathy, or do you think that all of the schools have embraced that for those students that are really wanting to do OMT for their practices?
Yeah, great question. And really trying to get a feel for that as I graduated and left Kirksville and saw the experiences of many other students. I think it's really become a level playing field in terms of osteopathic techniques. Obviously the push to include more research and become more standardized in our techniques, I think that's been very helpful on a national level and international level for osteopathic medicine. Where I think there is a little bit more standard approach across all of the COMs now to really facilitating that knowledge base and experiencing what osteopathic medicine really is and what it means and how you can apply it. I see it here at ICOM with my colleagues who are just amazing osteopathic principles and practice providers. They're younger and they're very passionate about what they do, and that's what you need. That's what you need at a medical school. And I look at what they teach here now, and I think, wow, I wish I could have had that type of experience. Of course, knowing what I know now, it means something different. But yet I still appreciate very much what I received at Kirksville and wouldn't take that away by any means.
Yeah, absolutely. Your interview was not too stressful. I've heard that Kirksville is really competitive to get into. Do you think that was true when you applied, and do you think that's true today?
Yeah, great question. I think it was. I certainly felt that competitive nature when I was there, but really having the experience I did, I came away fairly confident that I did well in my interview. I probably was on the lower end of GPA and other experiences that they may have been looking at, but I came away very confident in my abilities there and my desire to attend there. I think, it did become my top choice right after the interview. The other things that became clear to me, I got the opportunity while I was at Kirksville to be a student ambassador for the college and was involved in some aspects of the interview process for incoming students or applicants. And that was an eye-opening experience to see how many applicants they do receive or applications they receive. And it was a bunch. And so I felt very lucky and blessed to be a part of the student body once I saw that process from the internal workings of Kirksville as a student ambassador.
Yeah, absolutely. It is a rewarding thing when you realize how many students apply and you got the opportunity to do this amazing thing. Did you do any other special extracurriculars that you think aided in your practice today?
Yeah, I think being the student ambassador was very helpful. I also had an opportunity to be a coach for a basketball team that we had put together. And we had basketball, we had volleyball, and I took part in the basketball. I was heavy into sports in high school in my small town. And being a taller individual, that suited me well and was a great experience to work with other students and be involved in that little bit of leadership. I also applied for and had started a master's in health administration program that was brand new during my second year at Kirksville. And at the time, it was a new program, kind of developing. I think they were trying to get the fit of how much students could really do. And so I ended up dropping out of that program because it just wasn't quite established yet. And I felt like it would have been a little onerous for trying to facilitate my medical knowledge at the same time as learning and acquiring the MHA degree. So I did not complete that portion of my training for a dual degree, but I appreciated the offer, and it was a great opportunity to be in some of those classes as well.
Yeah, definitely. Did you take the USMLE?
I did not. I thought long and hard about that. We actually had about half of our class, so probably 50% of our class that ended up taking it. But I just had a sense that I wouldn't need it, for one. And two, I kind of knew the area I wanted to go was a heavily friendly osteopathic area for postgraduate training in Michigan. And that's where I ended up. But yeah, everything worked out great. I really had very limited desire to take the USMLE. I thought the COMLEX would serve me well, which it did.
Are there any special people that helped make your decision into the residency or into the profession that you went into?
I would definitely say during third and fourth year clerkships, I came across he was an internal medicine intern at the time that made a great impact on me in terms of his desire to acquire internal medicine knowledge. And at the time, I realized through some of my clerkship opportunities, I initially thought I may be a surgeon. I thought long and hard about that, and it just didn't fit with me once I was in the operating room and realized, I think I like using my brain a little bit more in terms of thinking through medical problems itself. And so the investigative aspect of internal medicine was very intriguing to me, and I realized, that's what I want to do. So I took up a clerkship opportunity just as a visiting student at one of our local hospitals in Michigan, where I ended up doing my third and fourth year training. I guess at the time it was seen as a very staunch facility for internal medicine training. And I was able to go there and rotate, and I hit it off with this intern that was extremely, passionate about what he did. He was gunning for gastroenterology fellowship, which he got and became a gastroenterologist, but he just intrigued me by the way he held himself and by what he taught me on the side as a clerkship student. And I just loved the area and loved the field. So that's where I went. I thought for sure I was going to become a cardiologist. And in fact, I actually had acquired a spot with a cardiology fellowship. But that may be a story I can share as well, if you'd like to hear it.
Yeah, absolutely. I'd love to hear it.
I was gunning for the cardiology fellowship spot, and my wife became pregnant with twins. This would have been babies 6 and 7 for us. So that was a life-changing experience. Hearing of that news while I was being a resident resident in internal medicine, I realized, I have a family to support. Do I really want to go another 2 or 3 years in cardiology fellowship? And decided to stick with general internal medicine, which I loved. And I knew that I may end up in a rural area where I could do a lot of cardiology and cardiovascular care, which I did. And so my passion for cardiology continued in my general internal medicine practice.
That's exciting. You got that news. I bet it was amazing.
It was a shocker.
Shocker. So you decided on internal medicine because of the problem solving and critical aspect of it. How did you decide what residency programs to apply to? What was important to you? Was it location or rigor of the program?
Yeah, I think, we were happy to be in Michigan, in the Detroit areas where I was. And one of the local hospitals there was very friendly to osteopathic students and had a very rigorous internal medicine program. It was kind of seen as the most rigorous internal medicine program at the time. And that's the one I really wanted to go to. I wanted that experience. I wanted the exposure to critical care patients. It had a very large ICU, about a 355-bed hospital at the time. And that's the one where I met this intern that made such a big impact on me. And so I applied there. A lot of other students said, "You're going there, that's a malignant place to go." They weed people out there, but I found it to be very friendly. The attendings were just amazing. We had attendings that were physicians at Cleveland Clinic, was one of our cardiologists that helped teach us as interns and students and residents, and was a full-time faculty there at the medical facility that I was at. So we just had an amazing experience. I picked up a mentor there, Dr. Stephen Katzman, who was an amazing mentor in terms of his ability to quickly evaluate a patient, and I still haven't been able to mirror his technique, but he could almost read people's minds. Was very impressive to me, and how he did that, and how he made it through many patients and evaluations, and just had a breadth of knowledge that I was intrigued with. And so he was a great mentor, as well as many of my cardiology fellows that I rubbed shoulders with, and all of the residents and interns and students that we got to be involved with there. It was an experience. We had great access to internal medicine patients, smaller teams. So I got hands-on very early.
Okay, so your residency program was a DO program?
It was. Yep. I was able to match up with the DO program at Botsford Hospital. That was my first choice, and lucky to obtain it. I don't remember the application process. It's so funny. At the time, we didn't have ERAS either. It was all paper. You filled out a little card and turned that into your program director, and he took care of it somehow magically on his side to communicate your wishes into the program. So it was much different, than the ERAS program nowadays. So
yeah, now it's all electronic.
Yes, which is very nice.
As if you know how to use it.
True.
Do you think that it was more difficult as an osteopath? You kind of spoke to the fact that when you went and visited the MD program, that you felt you had sufficient training to rub shoulders with them. Do you think that you ever missed out on anything, or do you think that your education was in some ways better because you got more hands-on?
Yeah, I think for me specifically, looking at where I would end up practicing, knowing that I may end up back in the Northwest in a more rural setting, I realized I probably needed a lot more hands-on training. And so it worked out extremely well for me. Yes, I did feel like I was very well trained in comparison to my allopathic colleagues. And, rubbing shoulders with them, we got along very well. I think it was a shock to them a little bit on how well we were trained from our institution. And it just worked out nicely. Yeah, I did not feel disadvantaged whatsoever at that point. And in fact, if anything, I felt advantaged to be able to have that experience behind me. Because it was, we had smaller teams. We had experience to get hands-on early as even a fourth-year student. And so that experience was indispensable for me in excelling my abilities and opportunity in internal medicine. I wouldn't have had otherwise, I think. I would have gone the allopathic route into a residency program.
Absolutely. So you definitely got a great education with more hands-on. Do you have any more specific stories that highlight your education versus the allopathic program or anybody else's residency programs?
Just some experiences. We had, at our hospital, we had a great access to many fellowship programs. So we were able to rub shoulders with fellows from cardiology, gastroenterology, oncology, hematology, and just wonderful training osteopathic physicians as well as allopathic physicians in the same program who were training us. And I just recall some experiences, one in particular, because I was really shooting to become a cardiology fellow as a student. I believe I was a third year on their rotation. It was one of our elective rotations with cardiology, right towards the end of third year or beginning of fourth year. I can't recall which. But I was on rotation with these cardiology fellows. There was two fellows, a couple residents, and myself, and maybe another student. And I recall the attending. He was, pimping us with some questions, and he asked one question that, for some reason, as a medical student, I just drilled myself down to know and understand about cardiology. And it had to do with an endocarditis case. And the opportunity came up to answer the question, and it went, of course, first to the fellows, then to the residents. And as I realized none of them know the answer, I knew the answer. And so it came to me, and I just blurted it out, and all of them quickly turned to me and looked at me like I was, smart aleck. And it was one of those experiences that I realized, hey, I guess I do know something that these guys don't. And so it gave me some confidence that I needed at the time as a student. And that's what you can bring to the team. Nobody was mean to me. It wasn't like, what do you think you are? Do you think you're better than us? because it's probably the only answer I knew that they didn't at the time. But it was one of those fun experiences. I had similar experience on the nephrology rotation. It was just my senior resident and myself, where I had a case I was following, and at the time I realized, boy, this person might have true adrenal insufficiency, and so I don't recall learning about transtubular potassium gradient calculations in med school, but I found it through my research about this patient case and ran the numbers, and sure enough, everything matched up. So I proposed that at our next rounding opportunity with the resident and the attending, and it was one of those experiences where they both looked at me and said, wow, we wouldn't have done all that, but you're right, this is what it is. So it was another building experience, and you really need those confident building experiences as a student, as an intern, as a resident, to really realize I can do this. I can really pick this up, run with it, become excited about what I'm doing, and when that happens, it's magical. And it really creates you as a physician. It creates the confidence you need, the abilities that you need to succeed. And that's what happened.
Oh, that's an amazing story. I love it. So your first job was as a hospitalist.
So I actually, coming out of residency program in Michigan, an opportunity opened up through a headhunter agency looking for someone to fill a position in wherever it was. Back then on the website, it didn't say the town, but reading about the opportunity, I knew exactly where it was, just based on my familiarity with Idaho and eastern Idaho in general. And it was back in Rexburg, Idaho. I told myself after going to school there for 1 year, I'd never want to go back again. It was too cold in the winters. There was too much snow. It was just a tiny little town that was a college town. But the opportunity opened up, and it's exactly what I was looking for. It was a hospital-owned clinic that they were just opening, and they wanted to fill it with physicians. And so I came. There was one other physician in town that the hospital had basically bought out and had joined, but she had multiple sclerosis, and at the time didn't fulfill a lot of shifts at this clinic, and so the clinic stifled. And the hospital basically, shortly after I got there, decided to pull the plug on this clinic, but offered me a chance to purchase the clinic from them. So I did. And so I opened up the clinic, and I had a resident come out of University of Utah program, an MD trained physician that was brand new out of the program. He joined me as a partner. I allowed him to join without any cost other than we purchased the clinic together, so to speak. And so we shared in that opportunity. So I actually was a general internal medicine physician and had my own clinic for about 6 years. But at the time, I had a lot of discussions with the hospital CEO of this smaller town that, we wanted to create a hospitalist program. He knew the politics of the area better than I did. He realized, the area wouldn't quite be ready for it, but he had predicted that it may take about 5 years to create that program and have it succeed. And he was right on par for that. We actually began opening services to cover as hospitalists, take care of family physician patients that they had normally taken care of themselves in the hospital. And slowly we began to develop the program, and they realized we weren't there to steal their patients. We weren't going to take those patients back to our clinic. And we offered a great service for these family physicians, plus both of us were well trained in critical care medicine, and we were able to increase the abilities at that hospital facility for taking care of critical care patients instead of shipping them. Previously, the patient ended up on a ventilator to support respiratory failure or sepsis. They were always shipped out, but we were able to keep those patients in our community hospital and take good care of them and had good outcomes. And so it was just fun building that experience. It was hard work. I had maybe 2 days off per month. It was the realities of building a program, sticking with it, and seeing it succeed. I wouldn't recommend it to myself today to go back through those experiences, but it was a life-changing experience. It was very neat being a part of. And so after that program was up and running, another bigger hospital 30 miles south of us actually opened up and developed a hospitalist program. And that was my ticket to get out of clinic medicine. I knew that I didn't want to be a office-based physician for much of my career. I knew I really enjoyed hospitalist medicine, and that's what I wanted to do. That was my real goal and aspirations, and so that gave me an opportunity to join their group as well as provide services to the primary hospital in Rexburg. So between those two opportunities, I was able to just turn the clinic over to my partner. He did want to keep the clinic, and so it worked for both of us. It was a win-win situation, and just turned out really well. So yeah, I guess about 6 years I was a general internist, and then I slowly transitioned into a strict hospitalist.
What are the pros and cons between those two, and what drew you to be a hospitalist?
Yeah, great question. And I think it's different for everyone. For me, really going back to that feel of investigative medicine, taking care of critical patients that have a real acute need, I found that I enjoyed that. I did not like ER medicine, even though you'd think, well, critical needs and immediate needs, great. But I liked time to think about a patient, follow them through their illness, and take care of them on a critical need, as well as have those difficult discussions with patients' family members. Sorry, your patient or your son or daughter is dying, and we need to make some decisions. I enjoyed that aspect of medicine. I enjoyed the critical care nature. I had, like I said, good training in my facility in terms of critical care. And so it became something I really enjoyed and wanted to continue that in the hospital setting. And that's really what made me love hospitalist medicine. I didn't enjoy all of the administrative aspects of owning a clinic, even though you'd say, well, you were a business major, right? Dr. Bates? Well, I was. And I understood those nuances of business, but it's not something that made me want to continue to do it from day to day. Let's put it that way. I found myself becoming a little, for lack of a better word, a little depressed going into work. I didn't look forward to that day in the clinic, whereas I did when I was on the hospital service. So I knew for me it matched very well. I'm grateful there's those that say, hey, I'd much rather do clinic than be in a hospital. I'm grateful that they are out there because we need those clinicians. We need people that do enjoy clinical medicine in the office. And I know that there's certain things that are advantage being in a clinic. You run it the way you want for the most part. Unless you're owned by corporations or hospitals, then you're kind of stuck to certain parameters that you need to follow and be a good team player. And I knew that I was a good team player in the hospital setting, and I just enjoyed all of the nuances of being a team player in the hospital, working with case management, social work, really that interprofessional organization and team, and working with students as well. I got the opportunity to train many students, medical students, pre-medical, some residents in our small local hospitals there in Idaho. And that was my first introduction to academic medicine as well.
Yeah, and now you work in academic medicine. What made you want to make that change?
That was a very difficult decision, and one that I really had to convince my wife was the correct decision. As you can imagine, after about 12 years in this community, we had become very well established. We had bought a wonderful home on 17 acres. It was a pristine, beautiful location, view of a river, mountains, out in the country. Able to get back to some of my farming roots as well. We had some hay in a field there that we took care of, and it was good for my kids to learn how to move irrigation pipe in. So we had a lovely experience, but we had bought that home about a year and a half before the announcement came that the Idaho College of Osteopathic Medicine was now going to be created and built. And I'd been following that on social media. I'd been following some of the early announcements and was extremely excited for Idaho. I wanted to take part in that opportunity somehow, some way, as probably a preceptor is what I was really considering at the time. But I had an experience going to a national meeting and meeting the new founding dean, Dr. Robert Hasty, who was at this national meeting. He was an internal medicine trained physician as well. And I got to communicate with him, and he said, we're looking for someone to apply for this position. Would you be interested? And I outright told him no. I had a new home, about a year and a half old. We very well established, but it planted a seed in me that I could not root out of my breast. So it was something that burned a hole in me for 2 days. And I ended up calling him back and said, I think this is what I'm supposed to do, and have not looked back. It was a great sacrifice. We had to move from this home that my wife loved. She was not too happy, but realized it was a good opportunity for her as well to pick up some new roots in a new environment here in the Boise area. And it's been good for us. Looking back, we did the right thing. It's hard to say that in every situation, but luckily it worked out. She's still married to me. She didn't leave me. It was good.
Were you ever afraid to work for a founding school that was not established yet?
I was. I remember some of the feelings I had as a student looking at Arizona school, because it was, again, I would have been in the second year class at Arizona, ICOM. And at the time, I remember thinking, they're not a fully accredited institution. That could be a real drawback. What would happen if they didn't get accreditation? And I'm a student there. So it was a sincere thought that went through my mind. And then now I'm in this position to be a part of a founding school, be a founding primary care chair, and really be involved in creating this and blazing this new trail, pioneering, whatever you want to say, Idaho's first medical school. It was exciting, but at the same time, a heavy load on our shoulders. We had to prepare well for accreditation bodies to come in.
What do you think are the pros and cons of working for a new school versus one that's established?
And I would say the biggest one that comes to mind would be the curriculum. So you have curricular history at an established institution that's been well-founded, well-tried. You go through all of the rigors of evaluating, reevaluating, tweaking, changing, adding to, subtracting. But when you're creating it fresh, you may have some models to try to look at and say, hey, we really like this model of curricular development. We really want to apply this here at ICOM. You still have to create everything that goes into that. And so that can be a real challenge as well as an opportunity. And, depending on how you look at that, I looked at it very positively that, we can take everything we know from academic sciences and really apply it here. Use all of the learning techniques that have been shown to be valid, validated learning techniques that students can really learn from. And we sought to apply all of that within our curriculum. And so that's been an experience as a new faculty member, as well as a new chair, a founding chair, just to really learn alongside of our many wonderful colleagues who have more experience that we can do this. We can apply this. We can make it our own. I think that's the positive aspect of it. Plus, we can be very open to change. As students give good feedback, constructive feedback, and professional feedback that we can use and properly apply and make changes on the fly very quickly. And I think that's been a very positive thing here at ICOM.
Yes, you kind of talked about being a pioneer for schools. What are your aspirations with our school or with other schools?
I just want to give my all to the creation of this ICOM brand, this ICOM school. It's obviously my home state. I just envision some great things happening for Idaho in general and the students here, and just trickling down into the communities that we serve and the areas that preceptors, who are involved with our students. They have an opportunity to get excited. It invigorates medicine in their areas, and they just become a greater force for good, a greater force for their communities. They can serve better. They can apply concepts, newer learning techniques, whatever it may be, to their practices, even in rural areas, and really through our students and their ability to go out and just expand the services in these areas is going to be a huge, huge benefit to our state and the surrounding areas that we serve.
Did you take loans for medical school? Did finances affect your choice of residency? And do you have any advice for current students or pre-medical students regarding the cost of medical education?
Yeah, and so obviously I was part of a private school as well, going to Kirksville, and that can be a big hurdle, for looking at, boy, I'm going to take on all of this debt. I was a young married student with children who had to maximize our lending capabilities to really support getting through this process. And so I can really side with those students who may have a family. And how do I pay for all this? How do I garner enough to be able to pay this back? Will I feel forced to have to go into a specialty that makes enough money to pay all this loan back? And I didn't want that to be a driving decision for me. That's not why I wanted to become a cardiologist in the first place. So yeah, it came down to really, can I manage my money well enough that I didn't have to worry about paying loans back? And yes, that's been difficult. I'm not going to candy coat that. You come out with huge loans. We came out with a significant amount, having to take the maximums that I could be allowed, along with a couple private loans to support my family and get through. I wasn't about to try to work at the same time as go to med school. That wouldn't have benefited me or my family at all. And so, yeah, that was a challenge. But I haven't looked back. We just keep plowing forward, paying off debt. So, yeah, it's doable. If there's one positive lining on that, I would say, entering medical school, you get through your first semester, you realize this is a great motivator for me to continue, because I don't think I could find a job out there where I could pay off the loans I've already accrued without becoming a physician. So it's a great motivator to finish and accomplish what you started.
Right.
So I would use it to that advantage.
Yeah. What specific advice would you give students that are currently in that predicament right now?
I would have been happy to go the military route myself and really have that opportunity to pay back loans through the military. My wife, she grew up in the military, so she would not have anything to do with that. That was a prenuptial agreement, so to speak, that I would never enter the military to pay off my medical school loans. But there's a lot of programs out there. I knew I was coming back to a rural area, so the health professional shortage area, the HIPSA designation was part of Idaho at the time. And I was able to get a scholarship for that, and that helped, significantly. So yeah, there's options out there to make it work. I would say deferment is a huge benefit. If you can defer paying the loans until you're able, then just plan that into your future. Don't try to expect that you're going to have the best house when you get out of medical training, and don't become house poor. It depends on the area you're at. Sometimes you can't help that. It's very expensive living in certain areas. But yeah, I think just looking at all of the options that you have to maybe help repay loans. There's a lot of hiring that, they give bonuses to join their group, or a loan repayment program. That was one thing coming out of residency. The hospital that was developing the clinic actually had a loan repayment program. Granted, that fell through because of the pullout from ownership of that clinic. But yeah, so there's options. Just look at all your options, become educated on what's out there and what you can do. But there's always that opportunity to pay off loans. So, if you can consolidate loans and consolidate them at the rates that are available now, that's huge. So I'd highly recommend looking at that. That happened for me. I was able to get a good rate on consolidating all of my federal and unsubsidized student loans. And so that was a great benefit and gave me peace of mind.
Perfect. My last question for you is, what was the best piece of advice you got throughout your education, and who was it from, that you would pass on to current students?
I remember it was a much older physician, semi-retired while I was at Kirksville. His name is extremely well known, Dr. Max Gutenson. He's a hallmark to the osteopathic community, but something he said stuck with me and was often quoted, and you hear it in other areas of medicine as well, but it's the often phrased, if you listen to a patient long enough, they'll tell you what's wrong with them. And that stuck with me in terms of, don't try to force things with a patient. This is a shared medical decision-making model. To be successful, to be a good provider, you really need to have that shared decision-making model with the patient and let them be a part of their medical decision. Yes, there's standardized processes, but really, how do you approach that with a patient, and how do help them see what's the best choice, but at the same time honoring what their choice may be. And I think that stuck with me long enough that I started believing it and employing it and appreciating it. And so that's been something that I use, that I try to teach as well. And I think that that's been extremely helpful for me.
That's beautiful advice. Well, Dr. Bates, thank you so much for being on the podcast today. I really enjoyed having this conversation.
My pleasure, and I have as well. Thank you so much.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tian Yu Shea. Thank you guys so much for listening to Do